so much of the experience of the young person with Rett syndrome or the child is dependent on that parent and their ability to function.
Yeah.
And that moment of diagnosis and the time that follows can have an impact on people for quite a long time. I remember for myself, I kind of look back at it as if I'd had a massive car crash or something and then just was very off kilter for 2 years.
Yeah. And it's so important that you've shared that, Rachel, because I think that will resonate. But for me, again, from a clinical point of view, a human and clinical point of view, it's trauma. Receiving that type of information is trauma. Absolutely, there's so much resilience and strength in our parents and families as well. Also about not sort of assuming that lots and lots of intervention is necessarily required, but also we shouldn't as clinicians miss the sort of strength and resilience that is there in our parents and families as well. But absolutely, it's a huge experience to go through, and there can be psychological consequences as well. So it's sort of just being able to, as and when is required, being able to sort of offer appropriate, modified, tailored support. Because that's the thing as well, you can access support, but what we've always spoken about over many years is that whatever we do has to be effective and add value. Otherwise, it's sort of no point doing it really. It's got to contribute positively to our children and families.
I heard you say earlier, obviously I'm asking you general questions about people with Rett syndrome and your experience of meeting people with Rett syndrome. And, I don't really want to say, I don't really want to ask you how children and adults with Rett differ from these other patients. A lot of time in Rett, we basically hear families say that they've taken their child to the doctor or even to CAMS, and it's just been considered that whatever they are having problems with is part of Rett syndrome. Do you want to just speak to that for a moment?
Yeah, no, absolutely. And I think it's again another really, really important point that you've made, Rachel. So again, with Rett, but again, this is what we see with other conditions as well. But there are differences with Rett as well. But this idea that actually all of a child's or young person's experience and symptom profile is attributed to Rett. Having a knowledge and understanding in terms of the aspects that are absolutely related to the core diagnosis and core profile. But I suppose what we know with Rett syndrome as well is that it's multisystemic. So we know that both on a physical level, a child and young person sort of, different systemic areas are impacted. So it's having a degree of knowledge and understanding of that. Absolutely, for me as a psychologist, it's always about staying in my lane and deferring to the appropriate medical expertise. But I think as a psychologist working with Rett syndrome, I have to have a sound knowledge base and expertise. And I suppose the other bit for me as well is that, and our families have said this to us a lot in Rett and other conditions over many years, what we actually know from our clinical work and research is that having Rett syndrome and multi-system physical health difficulties, but Rett's as well, it can make you more vulnerable to having difficulties in other areas. Social communication difficulties, you refer to autonomic dysregulation, but actually that's very much part of anxiety. And young people with Rett's can have mood difficulties. So it's also about not lumping everything together, because actually when we are able to accurately look at diagnosis in that way alongside Rett, that's when we can actually then implement much, much more effective treatment plans.